I'll just take you to a visual walkthrough to an IR Residence Day and see in the Department of Interventional Radiology at CMC Vellore. So we have two campuses in the IR department spread across the two campuses. This is the Vellore campus, which is the old building, and this is the new Ranipet campus. So in the Vellore campus, we have our own interventional radiology OPD. We have a mini DSA, and we have a main biplane DSA. And we have rooms for ultrasound guided interventions as well as CD guided interventions. And we also have a ward differently. We admit our own patients in these wards and take rounds. And in the Ranipet campus, I really like this pick, and the way CMC Vellore calls its department as a Department of Clinical Radiology, which has two subdivisions, the Department of Radio Diagnosis and Department of Interventional Radiology. Again, we have a consultation room within, and in the main OPD as well, we have two interventional radiology OPDs. Then we again, in the Vellore campus, we have a mini DSA in the Ranipet campus as well as a main biplane DSA. So we have a total of 4 DSAs, 2 biplane and 2 mini DSAs. We have rooms for ultrasound guided interventions and CT guided interventions as well at the Ranipet campus. And again, in the Ranipet campus as well, we have general as well as daycare ward beds. So for the IR department at CMC Vellore, it's a holistic and extensive IR care approach. We get exposure to head-to-toe vascular interventions. There are a lot of number of cases. We get 5 to 10 DSA cases per day at Vellore campus, 10 to 15 DSA per cases per day at Ranipet campus, and numerous non-vascular interventions are also there, like biopsies, drainages, ablations, and various nerve blocks for pain management. OPD exposures, we get national as well as international patients from Bangladesh, patients from Bhutan, and at the Vellore OPD, there's a footfall of 10 to 20 patients per day, whereas in the Ranipet OPD, we have 30 to 40 patients per day. Emergency exposure is there. We do a wide spectrum of emergency cases like stroke, neurocoilings, SAH, bleed embolizations, and we also help and assist other departments in their wards and OT when called for. Then ward care is there. We have a general and daycare wards, and we do regular rounds. There are morning rounds, there are evening rounds. We do pre-procedure assessment. We do post-procedure follow-up. At CMC Vellore, it's a mentee as well as a mentor approach. We have classes by a faculty and an adjunct international faculty. We have a regular MDTs with different departments. So here we are students, but we are not just students, we are also teachers. We have DM, PG and fellow teaching sessions in which we interact with the UGs and PGs, and we present with them, we teach them, and again we have projects and publications. Well, coming on to duties, I personally feel an IR is always on call, but because the presentation needs it, we have a weekly rotations between the Vellore campus and the Ranipet campus. And officially, when you post it in the Ranipet campus, you're on call for emergency duties. But as I said, I feel an IR is always on call. For accommodation, we have accommodations at Vellore and Ranipet. It's a decent community. The community life at CMC Vellore is something which I really like. It's a very close-knit hospital with a very friendly environment. The seniors, fellow residents, and hospital staff is very friendly. And I personally have done my education for the past 10 years in Delhi. So I was really concerned about the language issue because it's Tamil Nadu, but here, language is not a barrier at all. It's a very conducive environment. And again, Vellore gives you a myriad of opportunities to attend conferences and CMEs. It gives you opportunities to learn and present at national and international conferences, socialize with fellow IRs from across the country, and CMC Vellore holds its own CME, the Yorkshire Vellore International Radiology CME. So basically, these are picks from last year in which we have national international faculties for a 2-day CME, and we have IR residents from various colleges across the country coming and learning under the aegis of these pioneers of their respective fields. So thank you.